Save My Piggies, Your Life, Your Limb, Your Story, with host Dr. John Phillips and Kim McNicholas.
Mine was a long journey. I was at the time like 61, and I thought I was aging. And no, it was very painful to walk. It took me 5 years to get diagnosed. I kept going to the doctor and saying, I can't walk. It hurts. What's going on? And they went to my back, and it really wasn't bad, but they would just give me pain pills, which I don't like to take, and I didn't, because I thought, well, this is the aging process, and my age is. I did have a history of family heart problems. My dad died at 52, waiting on a transplant. I had a little brother that had a widowmaker, and another little brother that died at 15 days old with heart problems. So, of course that was in the back of my mind, but I couldn't get anywhere with that because they'd listen to my heart. They'd ask me questions about it, and that it stopped. So I would keep going. I did the whole Bengay, every hot and cold, icy cold. I did all of that for years. And so I started researching myself and found your Facebook page. And I went to the test to ask for, and it was the ABI. So I went, I did do the chiropractor thing too, and he said I was a mess, but my back was okay. But he was just saying I was out of alignment. I needed to get that done. So I did that for like a year prior to this. So wow. I go back to the doctor armed with the knowledge I learned from your Facebook page. And I said, first of all, I set him up kind of because I was getting kind of sassy at that point. And I said, hey, how are the pulses in my ankles? And
good for you.
Yeah. And she goes, oh, they're great. And I went, okay, I want an ABI. And she looked at me and she goes, well, they're expensive. And I said, I don't care how much they cost. I want one. And so they sent me over like the next day to the hospital to get one done. And I'm laying there, and they brought in machine number 2 because they thought machine number 1 wasn't working. That's how bad I was. They think I didn't know that, but I'm pretty aware. And so the next day I get a call that I have an appointment with a surgeon, and he's going to be contacting me. And so I was like, what's going on? Well, your numbers weren't good. So I said, I want them. I'm coming over and I'm getting them because it's not on the CMI chart. So I did, and they were horrific. And I met with the surgeon. And when I first walked in, he goes, where's your wheelchair? And I said, what?
Yeah.
What wheelchair? I don't have no wheelchair. I've been powering through this for 5 years. Why, I might have to stop a lot, but I powered through. I would mow my yard. I would do one swipe and stop and sit down and get back up and do another. It was bad. So he's like lecturing me and like, this is, you need to have a bypass, aortic bifemoral bypass. And I'm just like, at that point, I'm like, oh, whoa, you know what? And he's going on and on and on. Did you smoke? Yeah, I did, and I finally just stopped him because of his attitude. And I went, can you fix it or no? And he said, I can. And I said, okay, I'm leaving now because I have to absorb this. I have to get back on that Facebook page and see what's going on. So he said, well, we can't do it right away. We have to do all of these other tests first. So they did all the testing, and, they stopped when I was in I can't remember what it was called, a CT scan. No, it was actually in an operating room, and they put the dye through, and they stopped like in 3 seconds and said there's no sense in going any further. So they came into the hospital room at that point and did an echo, and it came back okay. And so then I'm on my phone Googling, of course, and I'm thinking, okay, what is the gold standard for detecting heart disease or heart issues? And it wasn't the echo. No, it wasn't. So they scheduled, what was it called? It was a stress test, a nuclear stress test. So then I had to go back for that. And that's where they found that I'd had a heart attack at some point, and they wanted to know when and where. And I was like, I had no idea. So the cardiologist then that was going to clear me for this big surgery, he says, oh, Darla, it's very small. They're very small. Don't worry about it. We're going to go ahead with your surgery. So they did. And I knew it was going to be bad because I did pick up a friend from your Facebook pages that was a mentor. And she was like giving me all this advice because nobody else did. Like, Darla, get food ready. You're going to be in the house. It was 3 months recovery time. So, and when you get out of surgery, they expect this, because nobody told me in the medical field, what that was going to look like. You're going to wake up with IVs coming out of your neck. You're going to be on oxygen. You're going to be out of it. Don't bother taking a book because you're not going to be reading. So I was in ICU 7 days. I didn't get to eat, drink. I got a cotton swab in my mouth once in a while. And then my sugar dropped way low, which I never had any problems with that prior to. But it dropped and I got a glass of orange juice and I remember being very thankful. I came home on oxygen, came home with a walker. So I didn't know, my family, I didn't have the support. They asked the surgeon when the day that I got released, they came to get me and they said, can she go to a nursing home? And I was like, no, I'm going home. And
Wow.
The surgeon looked at them and said, I have a feeling Darla's been taking care of herself for a very long time. So I did get to come home and he sent a nurse, PT and OT to the house for those 3 months. Well, the PT and OT I got rid of rather quickly because I was like, one day I was laying in my bed and I thought, I can't do this. I got stuff to do. I got to work. I'm a single person. So I folded up that walker. I shut off the oxygen. I have a pulse ox, by the way, so I knew I was okay. And the PT came to the house and said, Darla, what's going on? I said, I'm done with it. I'm done. I got to get better. So after the 3 months, I wasn't allowed to leave the house and it was hot out. So every time I went outside for a walk with the nurse, my heart rate just went crazy high. And that was something I didn't know quite how to figure out. So when I went to see the doctor to get clearance to go back to work and to get back to life, I said, can I have cardiac rehab with this? Because I just, I'm not progressing as fast as I should. And they're like,
Right. It was an aorto bifemoral bypass, right?
Right. So they ordered that, and I went out for my first one out to hospital, cardiac rehab, and they got the crash cart. There's people like twice my age walking and just doing great. And I'm like, what? And they said, your heart rate, are you on any medications, any beta blockers, anything like that? No. So anyway, I went back to see the cardiologist, and they all got copies of my readouts. And he was still like, oh, you're fine. You went through a lot. You're fine. And I'm like, I'm not fine. I need a left heart cath. And he goes, no, you don't. I will see you in a year. You are doing great. And I'm
And yet you're symptomatic.
My family was even thinking that something was wrong with me. Like I finally told them I had this surgery in July. I told them at Thanksgiving, I said, guess what? I get to have a left heart cath. only because I told the doctor, I thought to myself, I was fast thinking. I said, I can't breathe. And he looked at his assistant and he said, order her a left heart cath and throw in the carotid artery scan too. Good luck with your test, Darla. And I said, oh, you're not doing it? I was like, thank God. And so I told my family, I said, I get to have a left heart cath. And they just thought, nobody said a word. I go, oh, you don't believe I need it.
And so what was the ultimate
anyway,
result? You actually
I
did, in fact, need it, and they were able to.
I had 2 stents in my LID artery.
Wow.
Yeah.
Do you know how much it was blocked?
It was like 80 something, 83, maybe 84. And I have another artery, which I don't even know which one it is, but they're going to repeat the left heart cath next November.
They're going to do a heart cath, and they go in and they'll check out all the arteries and see if something more needs to be done. But your story is absolutely, incredible. And the fact that you fought and fought and fought. One final question. I mean, do you think, because an aortobifemoral bypass is frontline treatment, it is the gold standard even still, because the aorta is such a sensitive place, and you don't want someone, if you have 100% blockage in your aorta, you don't want someone just poking around with wires and catheters and things like that, because the risk of death is so high if someone perforates that vessel. So a lot of doctors do err on the side of going straight to an aortobifemoral bypass, because also it's durable. If done right, it can last above 20 years, right? But do you think that if it would have been caught 2 years sooner, that you would have been able to, excuse me?
Yeah, it was 5 years. I suffered
5
with
years.
Yeah.
If you were diagnosed 5 years sooner and you were able to get on appropriate medical therapy or medicine therapy, along with a walking program, change of diet, et cetera, do you think that would have made a difference for you? I know it's always, armchair quarterback, right?
But it's so true. I still think that to this day. I think because there have been, like my carotid arteries are also closing, like they're like at 70%. So that's another thing. So then now I'm on all this medicine and they're not messing around. Let me tell you, I am on the highest dose of cholesterol medicine there is. I'm on my, and I don't know if metoprolol is like a heart drug. Yep, usually, typically, and that's like short term after you've had a heart procedure. But I'm 2 years out, and I'm still on really high Brilinta. I'm on Zetia, however you say that. But I feel like some of this medication is causing other things. You know what I mean, like side effects.
So that is really important is every 6 months to schedule a medication review with your cardiologist. I think that's always important. It's something, my dad is a heart disease patient as well. And every 6 months we review the medications he's on to talk about side effects, to get some extra blood work to make sure everything is looking good. And so that might be helpful for you. Any last pieces of advice before we move on to the next session, Darla?
I just do. I just think just educate yourself, get on Kim's Facebook page, get all the information you can, because you are ultimately the only one that can advocate for your health. I feel that the sooner the diagnosis, the better, because now it's not only P.A.D, it's C.A.D, it's coronary artery disease, it's kidneys, it's everything. Your arteries are very, very important. It should be one of the first things checked, not one of the last. And a person shouldn't have to push so hard to get answers to why things aren't right.
Right, especially when you're actually symptomatic. And that's the biggest thing, is if you are presenting with symptoms, that is a good time to provide advanced diagnostics sooner rather than later. Thank you so much, Darla